as a respiratory therapist, we have been doing a lot. Main thing is we help people breathe. So especially with the pandemic and COVID, it's people who can't breathe. It's respiratory illness. So we're the ones that get called when these individuals get admitted to the hospital and end up needing help breathing. So we have all kinds of different therapies and things that we do to help with that.
Exhausting is the first word that comes to mind, and that's because it's been relentless. You know, there's been peaks and valleys, there's been, really busy times, and then there's been times when you feel like, okay, maybe this is over, and then there's another climb, and you feel like it's never going to end.
You know, you're so exhausted, and on your days off, you're getting called in for overtime and all that, but it's very hard to not be able to see your family or your friends. I find that was one of the hardest things for me, is just, you can call them and everything, but it's not the same thing. And so that was very hard.
I think so. It's and I hope there will be for globally. I hope people will not go to work sick or send their kids to school sick. I think that it's allowed me and many others to take pause and it's what really is important in my life.
It's hard to even say. I want to say no because it's such a horrible thing. I don't want to say that there were any positives, but to me, there is a positive, and it's that, as respiratory therapists, we don't get recognized at all. There's some places that we do get recognized, but it's just not enough. A lot of people don't know who we are, what we do, and we're kind of in the back light. So with this pandemic, a lot of it was patients are on ventilators and we need to buy ventilators, and so who runs those ventilators? Well, it's respiratory therapists. So that was a big thing, I think, for all of us working, is that we don't get recognized sometimes, and then having a pandemic that's surrounded around a respiratory illness, being able to be recognized